On a global front, we have made great progress in improving child health, reducing maternal deaths and disabilities, and increasing educational levels, especially for girls around the world. But there is one challenge where we could do so much more. Malnutrition in mothers and children, which continues to impose a staggering cost worldwide, despite having the solutions. Today, between 2 and 3 billion people around the world are malnourished. They either experience some form of undernutrition, are overweight or obese, or have micronutrient deficiencies. And globally, more than 160 million children under 5 are stunted. Stunting means that a child is shorter than normal for his or her age. Stunting happens over time and can be caused by inadequate maternal nutrition, poor feeding practices, or substandard food quality, as well as frequent infections which can slow down growth. Undernutrition contributes to the deaths of more than 3 million children under the age of 5 each year, or about 1 out of every 2 child deaths. Another growing phenomena is overweight children. Globally, 42 million children under 5 were overweight in 2013, up from 32 million in 2000. The numbers of overweight children are growing in low- and middle-income countries as well as high-income countries. For example, in 2013, there were an estimated 4 million under 5 children overweight in Latin America, 11 million in Africa, and 18 million in Asia. As we take inventory on where we have come and where we need to go to reduce malnutrition, we see that progress toward achieving the World Health Assembly nutrition targets is lagging behind. 4 of the global targets that we are currently tracking include reducing child stunting, reducing anemia in women of reproductive age, preventing a worsening of overweight children, and reducing child wasting. This is when a child weighs less than normal for his or her height due to malnutrition. Of the 99 countries that have data on these 4 indicators, only 4 countries are on course to meet 3 or more targets by 2025. 20 are on course to meet 2 targets. 44 are on course for only 1 target. And 31 are not on course to achieve any of these targets. So what has the experience and research on nutrition programs taught us over the years? And why are we moving so slowly? Well, the story starts with well-nourished adolescent girls and women. Babies developing in the womb draw all of their nutrients from their mother. If mothers are not eating the right foods or the right amounts of food, they put their baby's future health and development at risk. Pregnant women need essential proteins, vitamins and minerals to help ensure a safe and healthy pregnancy. But not all women are receiving these vital nutrients. Currently, 1 in 5 pregnant women suffer from anemia and are more likely to undergo complications or death during childbirth. Adolescents are especially vulnerable during pregnancy. Their bodies are still developing and are often not physically mature enough to deliver a baby safely. Pregnancy can also create competition for nutrients between the growing girl and her baby. As a result, pregnant girls can stop growing and may also suffer from conditions like anemia. For the child, the story rests in the 1,000-day window between pregnancy and a child's first 2 years. This period becomes the best shot at helping a child reach his or her potential and sets the stage for life. Let's take a closer look at just how critical this period is. Starting in the womb before birth, the fetus is at risk if the mother lacks essential vitamins, minerals and nutrients needed for brain, bone and organ development. Babies born to undernourished mothers are at an increased risk of premature birth, low birth weight and even death. Once the baby is born, from birth to the first 6 months, early and exclusive breastfeeding without adding any other foods or liquids is the very best way to ensure a healthy baby. And after the first 6 months of life, adding sufficient quantities of nutritious solid foods along with continued breastfeeding is absolutely necessary to make sure that the child grows correctly. Most stunting happens in this critical period. There is no going back. The cost of malnutrition during this 1,000-day window is almost always irreversible. Damage to the brain leading to poor educational performance and lower IQ, poor growth and development, and, surprisingly, this early deprivation increases a child's risk of developing chronic diseases as an adult. Chronic diseases like diabetes, high blood pressure, and heart disease requiring continued medical attention and care later in life. Another huge challenge is that malnutrition can happen and persist for years, and we can't always see it. These two little boys are both from the same village. Can you guess how old each boy is? Both boys are the same age. They are both 8 years old, but they show very different levels of development. The little boy on the left is stunted. This means that he has short stature for his age due to chronic malnutrition, and it's unlikely that he will ever catch up and reach his full height, or his full potential like his taller village playmate on the right. We know what makes a difference. 5 well-tested interventions to improve nutrition in the 1,000-day window, and they are readily available, affordable, and cost-effective. Beginning with ensuring that pregnant women receive vital micronutrients, such as iron and folic acid, among others, which can increase the likelihood of a safe and healthy pregnancy. Secondly, making sure that babies are put to the breast immediately after birth and are breastfed exclusively for the first 6 months. Thirdly, that mothers start giving a variety of healthy foods after the first 6 months of life, in sufficient quantities, along with continued breastfeeding through 2 years and beyond. This means making sure that mothers and children have access to the right amount of foods, and the right variety of foods, and that they have access to foods rich in vitamins and minerals, and are consuming those essential vitamins and minerals regularly. And lastly, making sure that parents and caregivers get information on improved nutrition and healthcare practices and the support that they need to feed their children in the best way possible. Research shows that nutrition investments are a best buy in today's financially strapped environment, because investments in nutrition pay for themselves. Children who get the right nutrition in their first 1,000 days are 8 times more likely to overcome the most life-threatening childhood diseases, complete up to 4 or more additional grades in school, go on to earn at least 20% more in wages when they join the workforce, and well-nourished children are more likely to have healthier families as adults. If we look at the cost-to-benefit ratio, the cost of key nutrition interventions compared with the savings, investment in nutrition produces returns up to 16 times greater than the initial investment. In other words, for every $100,000 spent on key nutrition interventions, we could generate $1.6 million in economic returns. Malnutrition is a global problem. Finding solutions must be a shared responsibility. Today, together, we must all do our part to keep the world on course and meet the global nutrition targets agreed to by the World Health Assembly. We must extend coverage of nutrition programs to more of the people who need them, and increase our efforts to study why progress has or has not been made in countries across the globe. We must mobilize resources and increase investments for nutrition interventions across sectors. with an eye toward improving the underlying determinants of good nutrition, such as improved health of infants and children, agriculture policies that support good nutrition, programs to help empower women, social protection programs, clean water and sanitation, and improved education. And we must become more ambitious and do more to hold governments, donors and agencies accountable for meeting their commitments to improve nutrition. We can't afford to lose any opportunities. By staying positive and working together, we can build on our past achievements. We can accelerate the pace of meeting the global nutrition targets. And we can stop the scourge of malnutrition once and for all.